Have you ever heard of a woman who didn't know she was pregnant until the very moment she went into labor? No baby born, no morning sickness, even the test showed negative. Now, it sounds like something out of the blues, right? And that's something we're going to be talking about today, cryptic pregnancy on Gyna Plus. A very good evening to you, and thank you for joining me once again on this very informative edition of Gyna Plus, right here on Afia Television. My name is Doris, and my name is Shisha. This is where we talk about health issues that affect women and girls, and sometimes children in the society. And yeah, this program comes up every Wednesday at 6 p.m. right on Afia TV. And today, like I mentioned, we're looking at something very unusual. It's a most of you are very familiar with. But then again, how much do you know about the word cryptic pregnancy and all that it entails? Right after the break, you will meet my guest who will give us insight to this. And trust me, you will learn more on the show today. Stick around, be back after the break. Welcome back. If you just joined me, you're watching Gyna Plus right on Afia Television, and this is where we discuss health information, health issues, health challenges that affect women and girls in the society and children as well. And my name is Doris Shisha. Before the break, I mentioned the fact that we'll be discussing something quite unusual, and that is cryptic pregnancy. I don't know if it's something you're familiar with or how much you know about it, but joining me now in the studio to talk about this topic is someone you already know. Of course, he's been here quite a number of times. I'm talking about Dr. Onyeabochukwu Duke, who is a consultant obstetrician and gynecologist, University of Nigeria Teaching Hospital in Suka. Good to have you, Dr. Duke.
Thank you, Madam Doris.
I mean, you always look fabulous. The whole shade of blue gets to complement my own colors.
Thank you.
We've had this discussion. I mean, it's long overdue,
Yes.
so to speak. But before we get into the topic properly, just give us a background to the term cryptic pregnancy. What is it really?
Okay, thank you, viewers. Now, cryptic pregnancy, the word originated way back the 17th century, where it was first described, a situation where a woman would be pregnant and she wouldn't know that she is pregnant until maybe later in the pregnancy, and maybe even some during labor, when they start having uterine contractions and in labor, then they will notice that they are pregnant. However, like I told you, 17th century. So during those time, there was no technology to detect that a woman was pregnant. The possible only evidence that a woman is pregnant is when there is protuberance of the abdomen. The tummy start getting big, and I would say you're pregnant, or maybe the woman has some morning sickness, vomiting, weakness, and then sleepiness. This was what will point then. However, that's then. That was what was the doctors tried to describe that cryptic pregnancy, the hidden pregnancy. The cryptic, the word cryptic means unknown, kind of. They are not revealed. So because a woman would not know, a woman herself would not know that she's not pregnant. Not that she is not pregnant. She is pregnant, but she herself, maybe because of some conditions or stress that she's passing through, may not know that she is pregnant. That being said, in this era, in this current time, the word cryptic pregnancy is not what it used to be at that time. People have tried to bastardize it for it to mean a pregnancy where you don't see, and that is a lie. So there is no pregnancy modern technology will not see until a woman delivers. So cryptic pregnancy, as it stands, is not cryptic pregnancy.
Does that rule out the possibility of a cryptic pregnancy happening? Because I mean, from what you've said, back in the days, back before the advent of technology, a woman can actually be pregnant. I don't know, you and I probably were not there back in those days.
Yes.
But then again, it's documented. Were there always cases where the tummy didn't have to grow out? Did that happen? And
Yes. Now let me say that a woman who is mentally not stable could be so stressed that she may not even know that she's pregnant. A woman who has some hormonal imbalance, for instance, may be not seeing her menses, because a woman that has hormonal imbalance, what we call layman term hormonal imbalance, may not be menstruating regularly every month, and maybe the menses will not come 2, 3, 4 months, and she may not bother because that's how it used to be, without knowing that she is pregnant. However, if the woman is subjected to any tests, for instance, what you use to confirm in this present time, what you use to confirm whether a woman is pregnant or not is the ultrasound. Do abdominal ultrasound or do transvaginal ultrasound. You will see the baby in the womb or outside the womb if it is not normally sighted. So you will know that the woman is pregnant. And then there is no pregnancy in this modern time that cannot be detected with the modern technology available. So that's why I'm telling you that what most people call cryptic pregnancy these days, we'll come to details, but what most people call cryptic pregnancy these days is not. It's a horse.
Okay, I like the background that you've given, and it's quite concerning because what prompted this discussion is some stories that I've heard over time. Someone tells you, okay, I know somebody who got pregnant and the baby was growing at the back, and then the hips begin to enlarge, the back begins to, the side of her tummy begins, no actual belly comes to the front like a normal pregnancy would be. So
is it possible?
That's what I'm asking. So
yes.
Are these scenarios true? Do they really play out? You've been in the medical science for God knows how long. Do they happen?
Yes, I have been a gynecologist for a long time now, and I have seen a lot. I've seen women, because our society places so much burden, so much stigma, responsibility on the woman. So most women who are finding it difficult to conceive and have their own children can do anything humanly, physically, spiritually possible to have a child. Anything you ask them to do, they go ahead to do it. I have seen a lot. Because of that, the society, those who are fraudulent, those who are criminals, take advantage of them to perpetrate evil. Now, I can tell you that there is nothing like the baby is growing at the back. It cannot be seen. It is not possible. The human anatomy was studied, unless it is spiritual. I don't know anything about spiritual. The human anatomy and physiology was studied. As in medical school, you are expected to dissect a cadaver from head to toe until you finish from head to toe. So you're expected to know every part of the human body, one after the other. You examine that you pass. Now, so there's nothing like a baby being at the back. Anybody that tells you that the baby is at the back, yes, a woman can have what we call ectopic pregnancy. That means that the baby is not growing in the womb. That on its own is a problem. Okay, so but even ectopic pregnancy can be detected by ultrasound or by other means that can be done. So there is nothing. When a woman tells you, they say that it is going at the back, it cannot be seen by ultrasound, it's fraud. It's fraud. It is non-existent. It's fallacy. So they take advantage of women and then give them all sorts of hormonal supplements and medications, and then their breasts, their tummy, and their hip will start adding weight their fatty tissues as if they are pregnant. And then they tell them, don't go to any other hospital. Today they will not see it. Scan will not see it. Or don't you must deliver in our facility. These are, fraudulent. And the unfortunate thing is that women, I don't know what they tell them, that once they get caught inside that web, inside that trap, they find it difficult extricating themselves. They find it difficult coming out. In my practice, in few years of practice as a gynecologist, most women that enter inside that trap, there is nothing on earth to tell them that will make them believe that what those people are telling them are not the truth. So they hold on to it and believe that their baby is still at the back. Imagine a woman carrying pregnancy for 12 months, for 13 months, for 20 months, waiting for the money that they ask her to pay for her to deliver to be completed. Once she pays that, they will make arrangement and say, "Oh, you deliver
in labor."
And they say, so it's fraud.
So, a lot is running through my mind, Dr. Duke. So, while I'm going to come back to this very point you raised, but I'd like to take you back a little bit. So, back in the days in the 1970s, you talked about the fact
in the 17th century. Yes, 17, it's not 19, okay. 16 something.
Thank you. Yes. 17th century.
Yes, the early time.
So these morning fever thing, the nausea, all these symptoms that are associated with pregnancy and early signs, where we said sometimes that's one of the ways that they normally detect that a woman could be pregnant.
Yes.
But however, because of what people believe these days, it's actually a possibility that I might not feel all of these symptoms.
And you're pregnant.
And then I'm pregnant. And then I'm still bleeding, menstrual, periods, they still flow. I still get to see my period. And then I still don't feel like I'm nauseous. And I still eat normally. Does that really happen? And then at what point does the pregnancy become visible? Even if it doesn't grow like to the front?
Yes. I've had a classmate who was pregnant. She knew she was pregnant.
Okay.
When we were in middle school, and secondary school, she knew she was pregnant. Nobody else knew she was pregnant until the day she delivered. She was not having any morning sickness. She was not tired. She was a young girl, maybe 16 or thereabout. She was a very young girl, and she was coming to school with a tummy, wearing school uniform. Nobody knew that she was pregnant. It could happen, but it doesn't mean that when they do ultrasound, they will not see the baby. No.
Oh.
The tummy, because if somebody has a very flat tummy, until the pregnancy reaches advanced level, you may not know that the tummy is growing. Okay, so it can happen, but I can tell you that the woman would have noticed that there are some changes in her body. Do you understand? Other people may not know, but the woman will know that there are some changes. Now, in the early times, yes, a woman may not even know that she's pregnant. Maybe 2 months, 3 months, up to 4 months. You may not know. Maybe she may be having some vaginal spotting, not really bleeding per se, but some vaginal spotting, spot of blood, and she'll think it's her menses. Then the pregnancy will be growing. However, if you subject that woman to ultrasound, you will see there is a baby in her growing. So it's different from what people now call cryptic pregnancy in these days and time. So they are not the same.
Wow, thank you so much. Before we take a break, now, are there actually health conditions that would make, let's say, a woman to get pregnant and wouldn't notice? Is it normal, so to speak? I know earlier on you mentioned hormonal issues and all of that, but I mean, is there more to this than just hormonal imbalance and other issues that will make one to get pregnant until advanced stage before they realize that they're actually pregnant? Are there conditions that make all of that happen?
Yes, there are. One is that if a woman is having irregular menstruation, a woman's menses comes every month. Some women will have 28 days menstrual cycle, what we call cycle length. Some may not have. Some may not be menstruating regularly. So if a woman is not menstruating regularly, some may not see their menses in 2 months. So you will just say, oh, this is normal. She's not seeing her menses, but she's pregnant. She doesn't know that pregnancy has occurred. And she'll be carrying up to 2-3 months before she will now start having a few of symptoms. She may not even have the symptoms at all until up to middle or advanced level. Now, that's a woman with irregular menses. A woman with hormonal imbalance, for instance, may have that irregular menses and will not know that she's pregnant, okay? A woman that is overly stressed. If you are overstressed, you may not put your mind into that and know that, oh, there is a pregnancy actually occurring. You might feel, oh, your tiredness is coming from workplace or some other stressors that are, without knowing, there are some physiological changes due to pregnancy going on in your body. So these are a few things that may make a woman not know that she's pregnant when she is actually pregnant.
And age is not one of them. So you can't just wake up one morning and see that your belly is growing and what if...
No, age. Young girls, maybe teenagers, might be pregnant. They may not know they are pregnant because one, they have not experienced it. They don't know what it feels like to be pregnant. So age, usually not at advanced age,
okay,
but at early age.
Okay, so one last question, because I'm pretty much interested. Almost like this is opening my eyes to a lot of information I probably didn't know about. So, but in a case where an advanced, maybe lady in her mid-30s or perhaps early 30s or maybe late 20s, starts seeing that there's actually an actual bomb and coming up, and then goes to the hospital. The hospital tells you the scan tells you, okay, you're not pregnant, there's no baby, there's no fiber, and okay, and then they tell you the whole baby going behind thing, and then you believe it. Are there steps that you're supposed to take, probably to medically? What are you even supposed to do? But I'll take a break now. Once we come back, we'll talk about that. I mean, you're still watching Gyna Plus right on Afia TV. I'm as surprised as you are, yes. I've been hearing about cryptic pregnancy. I've heard about it quite a number of times, but I never knew this part of it that Dr. Duke is talking about. So if you want to learn more, please stay tuned because we'll be back after the break. Welcome back. If you just joined us, you're still watching Gyna Plus right on Afia TV, and we're discussing something really informative and very unusual, and it's cryptic pregnancy. And sitting in the studio is Dr. Onyeabochukwu Duke, who is a consultant obstetrician and gynecologist at the University of Nigeria Teaching Hospital. So, Dr. Duke, we've talked about quite a lot, and I'm very certain that we can exhaust this today. However, before the break, I asked a question for a woman about my age or maybe younger who gets to see that her tummy is growing. But then again, other things in her body, let's say her period is still coming up as usual, but the tummy is growing more bigger than usual. Let's say there are changes in her body, so to speak. But what is the first step to take?
Now, from my experience, when this woman gets into the hands of the people that do the cryptic pregnancy, they start giving them some supplements. Some of them contain hormone medications that helps in fat accumulation. So most times, what makes the tummy to start growing big and coming out is fat accumulation at the lower abdomen and nothing more. So it is if the woman is noticing that she needs to, let me say for the often type, that in this modern time, there is no pregnancy that cannot be seen by technology. If you're pregnant, if you go to Lagos, they do scan for you, they will see you're pregnant. If you go to London, they will do scan for you and see you're pregnant. If you go to Calabar, they will do scan for you, provided that is expert. So when the pregnancy is not seen and they are telling you that it is only in their facility that you can give birth, then it's fraud. It means that there's no pregnancy ab initio. So something is amiss.
Okay, thank you for that perspective. I spoke to some women, in the course of doing this, I needed to sample some opinions, whether that person's, if this is something that is particularly new. And it really interests you to know that some women say they've seen cases where some persons they know actually, didn't know they were pregnant until about close to delivery date, and they came back with the baby. One even, talked about the fact that her friend, had a problem with her husband. They separated for 2 years before. However, I think they did they got back. I don't know how, but let's just take out some time and then listen to some of these women on their, view about cryptic pregnancy generally. We'll be right back.
Cryptic pregnancy is something that is not really new to me in terms of the name, but knowing what it entails and how it happens is something that I'm not really quite knowledgeable on. It is not exactly possible for a woman to be pregnant and not know, although there are slight possibilities at the beginning stage of the pregnancy, because maybe the woman might not know that she's pregnant from the first trimester, but as time goes on, the hormones begins to change, and also maybe the woman might be prompted to run a blood test, which of course can also show that she is pregnant, and also even an ultrasound scan can show that the woman is pregnant. So it's not exactly possible for a woman to not know that she is pregnant.
There are some people that will say that maybe they have seen someone that got pregnant without knowing that she got pregnant till the day she will give birth to the baby. I know that people normally show signs when they are pregnant. So I believe that the person might have seen some signs during the maybe early stage of the pregnancy. They will show signs, and I believe that the person will go to hospital and check what's wrong with her.
I've heard when someone is 5 months pregnant and she will not know that she's pregnant. She will be seeing her period, normal things, but she'll be feeling tired and the movement inside. When I fell sick last 2 years, I went to hospital. So a girl beside me was having this kind of the same problem, but the baby later died at 7 months. Yeah. So the girl did not know that she was pregnant until when
the baby formed to 5 to 6 months. That's when she discovered that she was pregnant. But when she went to hospital, she discovered that she was pregnant. But scan did not show that she's pregnant until, but later on it started disturbing the girl. So I don't know what happened. Maybe the baby formed outside the fallopian tube, but the baby died at 7.
Someone is pregnant and the person don't know that she's pregnant, maybe till 9 months. So I have a friend that had something like that. It's not even something like that. Like it happens to my girlfriend. She was pregnant, then I think during the 9 months she started having all these stomach pains. And when she got to the hospital, they now told her that she's about to give birth, and she was so surprised. And even the husband was like, this is not my child or something like that. They actually had issue. Then she delivered safely.
Welcome back. You heard that, and
Yes.
some of the opinions is not too different from what you've analyzed so far.
Yes.
But I just quickly like you to react to some. I mean, you heard the lady who said a friend just started having cramps and then rushed to the hospital, and I mean, she delivered.
Now, what I can tell you for sure, for you to take to the bank, is that if that lady who started having cramps did not complete her payment where they told her, she wouldn't deliver that day. In fact, as long as her payment has not been concluded, she can carry that pregnancy up to 20 months. So, as soon as your payment is completed, then you'll be ready to deliver. And then what they do, I don't know whether they hypnotize them or they give them some sedatives. They will give them some cuts at the perineal area. And then after they wake up, they say, "Oh, see your baby, you delivered." It is all fraud. It's all fraud. And the unfortunate thing is that people who are doing this are so rich and possibly engage the services of police and other security agencies to protect them. So I don't know what the government is waiting for.
But then nobody really knows what's happening. What do you even investigate? Because the women in question sometimes, like most times, it seems like they're usually not aware. Are they always on the know?
I will tell you that most women know, but maybe they take some form of oath to say, don't reveal this, or some of them may genuinely not know that this is fraud they are perpetrating. There has been a case of cryptic pregnancy, an undercover BBC agent, that went to somewhere in Anambra State or so and uncovered a whole lot of the secret things they are doing, and is on the net.
Okay, we'll talk more about this. And I mean, one question that runs through my mind now is, are there health implications? You talk about hormones certain medications being injected to act or induce the hormones, mimic the body system and make it look like one is pregnant. Are there actually implications health-wise over time? I mean, we'll talk about that, but for this week, this is where we're going to call it a day. I know this is something you want to know about, but be rest assured that we are continuing, like right now. We'll continue, and of course, you get to know more about these conditions, know more about the term cryptic pregnancy, what it really truly is, and all that you need to understand. And this will be up on our YouTube channel, Afia Cultural Lifestyle. You could go there, share with your friends, get information, so you will be on the know. I've been talking with Dr. Onyeabochukwu Duke, who is a consultant obstetrician and gynecologist, University of Nigeria Teaching Hospital, and we've been talking about cryptic pregnancy. However, we'll continue again next week on the same topic. Do stay tuned. My name is Doris Mayum Shishe. Thank you for watching.